Cherries. Today's video is about cherries and kidney disease. Cherries, delicious, nutritious. They're in season now, so I've been having a little bit more cherries lately. You have antioxidants, phytonutrients, vitamins, A, C, K, choline, tons of good things in cherries, but are they okay for kidney disease? That's what we're going to talk about in today's video. If you're new to our channel, make sure to subscribe. This is Healthy Kidney Inc. I'm Robert Galarowitz, a naturopath nutritionist and kidney survivor. And here we empower you with information to help yourself. Now, cherries. All right. I love cherries. Now, cherries, for the most part, they're very kidney friendly. Low phosphorus, low protein, virtually almost no protein, tons of antioxidants. Okay, they don't generally raise the blood sugar very high, but we do have two main types of cherries out there, being sweet cherries and then sour cherries. And cherries potentially could lower gout risk. We don't know that in kidney disease, but we do know that in the regular population. And when they study cherries with kidney disease, it's shown to be safe. Now, what's the one issue with cherries that we might want to look out for if we have kidney disease? It's the potassium content. Now, it's not a really high potassium content, and it does vary depending on the cherry, but generally like 10 cherries will be anywhere from 150 to 250 milligrams of potassium. So if you're like really have to watch potassium because that's an issue with you, you probably don't want to go more than like 10 or 15 in a sitting because the potassium could add up. And like I said, it all depends on those cherries, but you're not going to know how much potassium each batch of cherries is. So if you keep it to an amount of 10 to 15, that's fine. If you don't have issues with potassium, you can have more. You can have 20 cherries or so. You can have them as a snack. You can add them in anything. Now, like I said, there's two types of main cherries on the market. There's sweet cherries and sour cherries. Now, sweet cherries do raise the blood sugar a little bit more. Okay, they're a little bit higher on that glycemic index. They're at around the 60 area, which still keeps them very low, but they're not super low. So for most people with diabetic kidney disease, they're going to be okay with like 5 to 10 cherries. Generally, that's going to be fine. Maybe the higher amounts might affect you, but it always goes back to your individual situation, your health, your blood sugar level. So the only way to know is to test. Okay, if you're really worried about the sugar levels, you're worried about your diabetes, then you have to test. You got to eat a few cherries, test your blood sugar later to see how it is and see how your response is. Now, sour cherries. I just had a whole bunch of sour cherries from an organic farm. They were good, but they were sour. But the good thing about sour cherries is they don't really raise the blood sugar at all. Okay, their glycemic index is 22, very low. So if you have the choice of which type of cherry to get, prefer the sour cherry. Both of them are still okay. And maybe you do a combination. Maybe you eat 5 sour cherries and 5 regular cherries. Or you eat 10 and 10 of each cherry, whatever works for you. But for the most part, cherries are very kidney friendly, very good for you. You should try to have them a little bit more in your diet. Now, they are expensive and they're not always in season. So again, this is up to you, what your budget is, what you can afford. You can always look for frozen cherries, which are sometimes a cheaper option that you can put in smoothies. But it's an option. It's something that you can do and that you can help your kidney health with is by having some cherries in your diet. Thanks for watching, everybody. Check out the rest of our videos on our channel. Lots of good things to help yourself into your best kidney health. Bye.